Hi, my name is Dr. Ronald Adams. I'm a board-eligible chiropractic neurologist, and I'm currently pursuing a diplomate in clinical nutrition. I've attended coursework in functional medicine, functional blood chemistry, mastering the thyroid, neurotransmitters in the brain. I've also done some postgraduate work at Harvard University for Alzheimer's and metabolic syndromes. And I'd like to welcome you to our clinic. Today, we're going to be talking about how we help our patients with chronic knee conditions. If you've ever suffered with a chronic knee condition, you know how debilitating it can be. The treatment that we use is very comfortable. We use a specialized bench that helps us to increase range of motion, muscle strength, and also stability in the patient's knee joints. One of the pieces of equipment that we use for people with chronic knee conditions is a neuropathy rehab therapy. We find that many of our patients with chronic knee conditions will start to have numbness or tingling in their legs or in their feet. This particular device allows those nerves to start functioning properly. Many of our chronic knee pain patients have contracture of the muscles, ligaments, and tendons around that joint. We use a very focused technique called myoneuroreduction. What that does is it allows us to send signals up to the brain that causes these muscles, ligaments, and tendons to relax, thereby reducing the pain and the swelling in the knee joint. One of the most integral therapies that we use with people with knee pain is decompression. The knee joint itself has a layer of cartilage in between. That cartilage acts like a cushion. There's also a lubricant that's inside of there called synovial fluid. As the synovial fluid is depleted, the knee joint will start to have compressive force against there, and that's what eventually will cause that bone-on-bone pressure. With decompression, we're actually opening up that knee joint, creating a vacuum within that space and allowing that fluid to come in to provide more lubricant. We also utilize the latest in cold laser technology. The MR4 medical laser was originally designed to help with surgical wound healing, but we found it works great for reducing inflammation, blocking pain patterns, and also to increase blood flow. The laser itself is painless. It's actually a cold laser, so it does not generate heat, nor does it burn the tissue. One of the unique features of the MR4 is it has not only a laser shower head, which you see here, but it also uses laser stim, where we're combining therapies to increase the healing process. We also offer on-site x-ray for our patients' convenience. And we use vibration therapy for people that have chronic conditions. It helps with lymphatic drainage. It also helps to increase the firing rate of the nerves going to the brain. Vibration is a very valuable tool for people that have chronic neurologic conditions. Vibration stimulates the nervous system and increases the firing rate to the brain. For those with autoimmune conditions, it will help stimulate the lymphatic drainage. For patients with chronic neurologic conditions, we use neurointegration. Neurointegration has been shown to create permanent changes within the brain by reading brainwave activity and using photic stimulation to improve the firing of the brain. Neurointegration therapy is a breakthrough non-drug therapy for emotional, learning, and stress-related conditions. People with anxiety, insomnia, depression, memory loss, and fibromyalgia, just to name a few, can benefit from this therapy. In order for us to be able to help people with diabetic or peripheral neuropathy, we also utilize three-dimensional foot scanning. These are very advanced scans of the feet, which when we use custom orthotics, it allows us to provide more stabilization to the plantar vault, will increase blood flow, and also increase nerve flow to allow for better sensation to the feet. We pride ourselves on providing one of the most comprehensive neurologic, physical, and metabolic evaluations available to help us get to the root cause of your condition.